We have Tracy on the line. We have Alex Putterman, Fox 61, NBC Connecticut. We're just letting everybody in. We'll give it another second. We're still admitting and people are still joining. So we'll give it just another second here. All right, looks like everybody is in for now. I'll admit as I see folks coming in. Welcome everybody. Just a quick reminder, if you're not speaking, just keep your line on mute. We are going to do brief introductions first. We'll take questions at the end. If you could just jot your questions in the chat room, that'll be easier. I'll read them off and we'll have the appropriate expert respond to those questions. So we have with us Dr. Ajay Kumar, who's our Chief Clinical Officer. We have Eric Arlia, System Director for Pharmacy for Hartford Healthcare. And we also have Keith Grant, APRN, Senior System Director for Infection Prevention here at Hartford Healthcare. So thank you all for joining. And Ajay, I'm going to turn things over to you.
Thank you, Tina. Good morning, everybody. We decided to get this meeting together just to talk about the boosters and vaccinations in general. There has been a lot of information flowing in the last several days, and we expect some more to come as the week progresses. So I'm joined by my colleague, Eric Arlia and Keith Grant to answer and provide some clarity regarding where we are in the vaccination journey, which is level set at Hartford Healthcare. We still have about 96 patients, 98 to be precise this morning, admitted in Hartford Healthcare in different regions. We are still seeing largely unvaccinated individuals who are requiring hospital care or critical care or ventilation. Mortality still remains higher in unvaccinated individuals at this time. As we navigate this pandemic, vaccinations are a very important tool for us to manage this dreadful disease. With that, the discussion about the boosters has been somewhat confusing, and we were hoping to provide some clarity regarding that. So I'm going to turn to my colleague, Eric Arlia, who's going to talk about where we stand with all the vaccination and boosters. Thank you, Eric.
Thank you, everybody. Good morning. So I want to give everybody an update on exactly where we stand with booster doses. You may recall a few weeks ago, right around Labor Day, we did receive authorization for booster doses for both Pfizer and Moderna for immunocompromised patients. That remains in effect today, and we have treated many of those patients in our clinics, giving them a third dose of one of those two vaccines. Each time one of our vaccines comes up for review for a booster dose, it requires the FDA to review it, and it's usually done one brand at a time. You may recall back from the end of last year when we first started using the vaccine, they were approved individually as the company provided data to the FDA. But using the vaccine and starting to use it in our community is really a two-step process. So the FDA part of it, which is part one, occurred on Friday. What we're waiting on now is what I'll call part two, and that's to receive guidance from the Advisory Committee on Immunization Practices, commonly known as ACIP, which is part of the Centers for Disease Control. And that's a committee that predates COVID. It's a committee that has always given us guidance on how to use vaccines. So this past Friday, Pfizer's vaccine came up for review. Pfizer had requested that it be approved for all people age 16 or over who received the Pfizer vaccine 6 months after they received their second dose. The FDA committee decided not to give it that full approval, but they put some restrictions in place. And what they came up with was patients who are 65 years of age or older and patients who are at high risk of developing severe COVID. So that is what the FDA approved, and that is what the ACIP committee, when they meet this Wednesday and Thursday, will review for the Pfizer vaccine. And again, remember that each vaccine does its own studies and submits its own data to the FDA and to the CDC, and that's why they get reviewed individually. We expect to hear more about the Moderna and the J&J vaccine in the coming weeks as they provide data to the FDA as well. So when the ACIP committee meeting concludes on Thursday, we hope to have the official guidance on how we can use the Pfizer vaccine as a booster dose. And once that occurs, that's when vaccine providers such as Hartford Healthcare can start to plan how to roll that vaccination out. So we'll all be waiting. We have many teams on standby. We've done a lot of pre-work to prepare for this moment. And as soon as we get the final guidance from the ACIP committee later this week, we'll begin the process for those who are eligible. So that's where we stand today. And like I said, hopefully by the end of this week, we'll have more clarity on exactly who we can begin giving the booster doses to. I see a question in the chat box about
yeah, we'll get to the questions in
Okay.
1 second. Eric, Keith, do you want to add anything in introductions?
Yeah, absolutely. Thank you for giving us the opportunity to speak about this. I think there's a lot of questions coming up about, as Dr. Kumar and Eric spoke about regarding the boosters and a lot of other things regarding the vaccine that's happening nationally. As Eric stated, hopefully when the ACIP concludes their meeting, we'll have some clarity on, Moderna booster conversations regarding J&J as well. There's also some conversation regarding brand mixing and the possibility of that, especially in certain communities. As the current status of COVID-19, when looking at breakthrough cases, I think, initially, the data that we had regarding or immunocompromised patients showed that predominantly there is significant concern for breakthrough cases in immunocompromised individuals, and hence the initial approval for boosters. And if you look at the data around the country now, which is consistent with the data in Connecticut and at Hartford Healthcare, the number of individuals that are over 65 that are falling within that breakthrough case group is pretty significant. So I think based on our data here, based on the data nationally, the FDA's and ACIP guideline is very consistent with what we believe is necessary to continue to curb this pandemic.
All right, thanks, Keith. We do have a lot of questions coming in our chat, so I'm just going to go in order. We're going to take the first question from Dave Altamari from the Connecticut Mirror. Do you have totals on how many third shots you have actually administered?
I don't. Eric, do you have the numbers? If not, then we can come back to the team later on.
Just a rough estimate, around 2,500 doses for the immunocompromised. We can get an exact number and follow up.
Okay, we'll circle back with that. Thank you. Mike Savino from Channel 3, who is considered, quote, high risk for serious COVID, and is that a larger group than the immunocompromised?
Eric, you want to take this on?
Yeah, so we don't know exactly how the ACIP committee will define it, but what we do know is the CDC already on its website has published a definition of certain disease states for patients who are at higher risk of developing severe COVID. So I think it's fairly likely that they will adopt that list, although it's not definite. Just a couple of the high level items on there: people who have diabetes, people who have heart disease, many disease states like that. You've heard them spoken commonly, as we've gone through the pandemic and talked about who is most greatly impacted. It's definitely a larger subset than just the immunocompromised patients.
All right, thanks, Eric. Tracy O'Shaughnessy from the Waterbury Republican American. Do you have enough shots if ACIP suggests boosters for Pfizer?
Yeah, thank you for that question. One thing I can't stress enough is vaccine constraint is no longer a concern. We have plenty of doses on hand in our system, and we have the ability to order more doses each week. We haven't really had any vaccine availability concerns since probably April. So we feel very confident that we will have enough vaccine to meet the demand of anyone who's eligible for the booster and interested in receiving it.
We have a series of questions from Alex Putterman at the Hartford Current. The first being about process. What will be Hartford Healthcare's process for distributing boosters? Will people be notified? Will they have to make appointments, or can they just walk in?
Eric, you want to continue?
Sure. So, last week, we reached out to people who received their vaccines from us in the springtime and actually to date to let them know that we're monitoring the situation. And we asked them if they would be interested in receiving notification when they become eligible for the vaccine. And we really got a very high response rate to that. So our plan will be to use any information available to us, people who get regular care here at Hartford Healthcare. We know how old they are. We may know some disease states that they have. Once that becomes finalized, we will use our technology to push a notification out to them and offer them the opportunity to make an appointment for a booster dose. I think in the first phase of the booster dose vaccinations, we're likely going to make it by appointment until we have more of a feel for what the demand will be. But as soon as we know that is able to easily be met, we can consider making it available to walk in as well.
Okay, continuing on with Alex, his question. Does Hartford Healthcare's total count of patients with COVID include those who are admitted for other reasons and test positive for COVID? If so, does this make up a significant share of COVID patients?
So,
Yeah, I think, Keith, why don't you take this on? Thank you.
yeah, absolutely. So the majority of individuals, let's go back just a little bit. So currently at Hartford Healthcare, for any reason you're getting admitted, you're getting a COVID test is done. And that's, for us to maintain surveillance and safety within the institution. So it's number one. And from that data, we're able to capture individuals that are asymptomatic and are positive. Some of these individuals have been vaccinated. And so we've gathered data from unvaccinated or vaccinated individuals with breakthrough cases that are asymptomatic. So regarding individuals that are symptomatic, I'll give you just some simple numbers that we have right now we're working through. So off the 196 breakthrough cases that we've seen up until this point, and 49 of these individuals are admitted in the hospital. And from that 49, only 26 of these individuals have come into the hospital with symptoms of COVID-19. We continue to work through this level of data and continue to compare data with other individuals across the country and across the state. As it stands right now, this is very consistent with the state data. Yale and our partners at Trinity have also seen anywhere from 10% to 20%, 30% of individuals that are in the hospital that are COVID-19 positive with breakthrough cases came into the hospital with the primary symptoms of COVID-19. That makes sense.
All right, thanks, Keith. We have two more questions from Alex, and then we'll continue on with the other questions in the chat room. His third question: in Connecticut, state numbers show that about 25% of people hospitalized with COVID are unvaccinated. Nationally, I've seen estimates that are close to 5%. Why the large discrepancy?
Can you repeat the question? So 25% of individuals in the hospitals in Connecticut are COVID positive, they're vaccinated?
Right. In Connecticut, state numbers show that about 25% of people hospitalized with COVID are unvaccinated. Nationally, I've seen estimates that are
All right, I got that wrong.
No, that's
yeah, sorry. 25% are vaccinated.
Are vaccinated.
Oh, Alex, so this is a good question. And we have actually had an opportunity to address this question before. And this goes back to the conversation we just had, wherein yes, 25% of individuals, actually the number is probably a little bit higher now. So about 28% of individuals that are within the breakthrough that are COVID positive in hospitals across the state have been fully vaccinated. However, again, one of the things to be appreciated with this vaccine is individuals who generally get the COVID-19 virus or have the COVID-19 disease are remaining asymptomatic or have very mild symptoms if they're fully vaccinated. So a number of these individuals who come into the hospital aren't here because of symptoms from COVID-19, but they're here for something, a completely different reason. I think a more interesting data that should have been publicized is what percentage of individuals who are COVID-19 positive and are fully vaccinated, what percentage of these individuals are in the hospital because of symptoms as a result of COVID-19. So if you look at our data of the 196 cases that we have that are breakthrough cases, 26 of these individuals at this point in time, so not in the hospital right now, but generally since we've been seeing COVID-19, were symptomatic or are symptomatic. Hopefully that makes sense. So I would say about 7 to 10% generally is what you're looking at.
Alex, I'll just add one other comment to Keith's explanation. It's sometimes difficult to understand what the policies each hospital has across the country. And as we indicated, we test every single individual who comes to the hospital and gets admitted. It may not be the case in other hospital systems, so the rates could vary. That's some of the challenges we've had about the data comparison as well. That's why I think Keith's point about the mortality, which is a hard number, is something we need to continue to focus on.
Great, thanks, Ajay. Alex has one last question. Has Hartford Healthcare seen an uptick in COVID-related cases among children recently?
We haven't seen much of an uptick among children. We've seen an uptick, I'd say, in our 25 and older. We've definitely seen an uptick, but that's not within the last month. That's I think within the last 2 or 3 months. Nationally, however, there's been a significant uptick in children. In August, the week of August 14, the data was 1.4 per 100,000, which is an increase. It's a 5-time increase to the previous 2-3 weeks. So that there's definitely an increase nationally for pediatric population. In Hartford Healthcare, we haven't seen that much of an increase, but over 25, we've seen an increase.
All right, this next question may be Eric for you from Tracy, the Waterbury Republican American. Will ACIP also discuss J&J and Moderna or just Pfizer?
I believe they're just discussing Pfizer this week, Keith, unless you've heard otherwise.
That's Pfizer only this week.
Yeah.
Just Pfizer this week. There are some other things to be discussed afterwards to include Johnson & Johnson and Moderna. There's a few other topics, but right now it's just Pfizer.
All right, next in the chat, Mike Savino from Channel 3. Is there a concern people will claim to be high risk to get a booster shot, even if they are not actually in that group? Should they, or are there health risks?
I'll comment on that. Generally, I like to believe that people do the right thing and they will follow the right protocols and suggestions. It's difficult to comment how high risk will be defined by ACIP by Wednesday or Thursday. And I'm sure the public will be informed through Hartford Healthcare channels and other means. They'll make the right decisions. Tracy's question, I'll just take that on. Tina, if that's okay.
Yeah, go ahead.
Does it mean all healthcare facilities contact people who got their boosters in the same place as they receive their additional dose, or is that just Hartford Healthcare policy? We are commenting about Hartford Healthcare process. We are proactive in making sure our patients are reminded and we informing them where and how to get the boosters when they qualify, when they're ready to receive. And we'll continue to do so as we've done that from the beginning of pandemic. The next question is, what percentage of individuals who are COVID-19 positive come in because of symptoms? I think Keith has already explained that quite in detail, so I'm going to move to the next one.
Dave Altamari from the CT Mirror, breakdown of by age for the 196 breakthrough cases that we've seen.
Oh, by age?
Yeah.
The average age for admitted patients COVID-19 positive in the breakthrough case is 72 right now.
Wow.
Okay, it looks like Tracy has a follow-up question. Those 26 patients who come in with the breakthrough infections, are there commonalities in them? That is, are they older, have comorbidities, any behavioral similarities?
Age, from an age relating perspective, the last time we did a percentage age breakdown, it was about 84% of these individuals were over 65. The current data we're looking at, it looks like that's still very consistent. So over 80% of these individuals are over 65.
That looks like the questions in the chat for right now. Does anybody have any other questions? Feel free to ask them in the chat. While that happens, do we want to just do some final thoughts? Ajay, do you want to kick that off, or Eric or Keith?
So I'll start really quickly, because then Dr. Kumar might have something way more profound to end with. So the one thing that I think is very consistent with conversations that I've had over the last few weeks, and I'm sure Eric and Dr. Kumar as well, like, how do we communicate about breakthrough cases? And this is very, very, very important. So within our health system, we will capture breakthrough cases because we're testing for breakthrough cases. The significant number of individuals who will contract this disease process that's fully vaccinated will be asymptomatic. The individuals that we see within our health system they do predominantly, they will do much better if they are fully vaccinated than if they're not. And if you look at the data across the country from a mortality perspective, that's very consistent. About over 98% of the individuals over the last month who have died from COVID-19 in hospitals are individuals who are not vaccinated. So again, breakthrough cases is at this point, I don't want to say a compounding factor, but a significant element in breakthrough cases is the fact that we're surveying significantly. So individuals coming to the health system, we're testing them. So whether or not you're symptomatic for COVID-19, we'll pick up on it. But a question to be asked is, if I'm a older person or I have COVID, some conditions, am I more protected if I'm vaccinated? The data that we have right now profoundly prove that is the case.
All right, Ajay, Eric, before your final thoughts, we have a couple of more questions coming into the chat. The first from Leah Johnson: will booster shots be mandatory for Hartford healthcare colleagues? Is the third dose any different from the previous?
We have not discussed about the mandating booster shots at the moment, given the guidelines have been somewhat sporadic from CDC and FDA perspective. The third dose is different or not, Alex? Eric, I believe they're the same.
Pfizer is the same. Moderna is testing half the original dose.
Thank you. Tracy's asking, can you talk about the Israeli data, why it prompted the idea for boosters and how that may or may not be applicable to US? Tracy, it's a great question. I think Israeli data is very important for us to review. And I think my assumptions are that FDA has taken in consideration all the data and made a decision at this time here. One could argue whether the US should follow the US Israeli data and allow the boosters to be given to everybody. But given where the FDA voted with the 18-0 in the last cycle, I would imagine they've evaluated all possible options. So we'll rely on FDA's recommendation and ACPI's recommendation at this time. However, I think it's really important to note that sometimes these decisions could be made from the White House as well. So we'll wait to hear what the final conversation will end on this matter by the end of the year, end of the week.
All right, a few more questions coming into the chat. Alex, at the current, given the level of third dose uptake among immunocompromised people, what do you expect interest will be in the broader booster campaign?
Alex, you raise a great point. We have also shared our concerns about the low uptake on the immunocompromised individuals on the boosters so far. We're hoping folks will come around. It's still early in the stage right now. And I'm hoping that the booster will be widely accepted among the general public. I think this does take some more time and folks to review all the guidelines in detail. So we'll continue to do our part to educate the public at this time.
All right. Mike from Channel 3, it seems like Pfizer is close to seeking approval for kids under 12 to take its vaccine. What conversations are doctors having now to prepare parents to make a decision?
Mike, Hartford Healthcare has always been forefront with transparency in providing information to our colleagues across the system, and we will continue to do so as further information evolves. It's exciting news that the Pfizer is close to providing vaccination for 12 and under. And I think we were hoping by October this will be the case. And looks like that's what's happening. So we will be prepared to advise parents and community at large.
Okay, another question from Tracy. In the US, we still only have 56% of adults vaccinated. What does that portend for people going for the booster shots?
Tracy, I look at the brighter side, that the folks actually will come around and look at boosters providing further immunity and safety, and people will come around to that. We still have work to do. We realize that in our country, and we'll continue to support wherever it's needed.
Follow-up question from Mike from Channel 3. Can Pfizer come back to seek approval for booster shots for people under 65 as more research comes in? Do they have to wait for a certain period of time?
Yeah, they definitely can come back. But you know what, and very in line with what Dr. Kumar just stated, CDC has proven that they're being very consistent with reviewing data at every level. So I think if there's enough data, if you look at our data, with our average breakthrough cases, it's over 65 years old. That's consistent with the recommendation of CDC, FDA, and ACIP at this point in time. So I think if that shifts, then absolutely, definitely, they should and they would come back to try to get a different level of approval.
Okay, Nicole Leonard from WNPR came in a little bit late, but is asking about, has Hartford Healthcare had any trouble getting people to come back for their second shots for Pfizer and Moderna vaccine? Do these people make up a small percent of everyone getting vaccines, and what may prevent people today from getting their second dose on time?
I can take that one, Dr. Kumar. We actually, we received feedback from the Department of Public Health on this. Hartford Healthcare has done very well with people coming back for a second dose of the messenger RNA vaccines. Greater than 97% of the people have done so. I think our whole state is really doing very well with it. We are doing probably a little bit better than average. I think making sure that we have availability for the second dose in multiple sites is a key to success. Using our technology to send push reminders to people if they haven't scheduled a second dose also helps. And then I think the third thing that we have done and are actually continuing to expand on is offering the vaccine in more sites. We're continuing to add more medical group practices in Hartford Healthcare that will have the vaccine available, making it, trying to make it as convenient as possible for people to receive it.
All right, thanks, Eric. Tracy, a few other questions. Has the confusion over the booster question in your mind undermined belief in the vaccine?
Yeah, I'll take that. Tracy, I think there are folks actually who believe in vaccine and folks who don't believe in the vaccine. I think the folks have made up their mind. I imagine the people who believe in vaccines, who have taken the vaccine, will continue to take the boosters as well. I don't think it's undermined the belief in vaccine, but it has a risk of confusing public greatly on that part here. That's one of the reasons we are providing clarity in this meeting.
Tracy also asked, I understood Israel's example was different because after they vaccinated nearly everyone, they went quickly back to large unmasked public events. Is that accurate, and does that skew their results?
I can't really comment on that, Tracy. Keith, you have any comment on that?
I don't think it skews their result. And I don't think what we look at is we look at, so let's say we make a decision here at Hartford Healthcare. We don't look at, let's say, something that happened at WashU or Emory, and we say, let me see your data, and we're going to make a decision. It would potentially play into the decision-making process. So I agree with you. The data in the UK epidemiologically has tracked very similar to the US, but we're not going to make decisions based on that. And same thing, it's just another perspective. Socially, they have implemented processes much different from ours, and I understand how that could impact their data quite significantly. But at the same time, they do have data that prove that there's a population that had a decrease in immunity, and that's how they approached it.
All right, thanks, Keith. Last question from Tracy. Could you break down COVID cases throughout Hartford Healthcare's individual hospitals? Ajay, do you have the numbers?
Yeah, I can go over that. Bacchus Hospital has 20 patients today. Charlotte Hungerford has 10 patients. Hartford Hospital has 29 patients. Midstate Medical Center has 9 patients. St. Vincent Medical Center has 9 patients. Hospital of Central Connecticut has 15 patients, and Wyndham Hospital has 5 patients.
All right, thanks for that roundup. That looks like it for the questions in the chat. Eric, any final thoughts for the group?
No, like I said, it has always been a two-step process for us to begin using the vaccines, all the way back to the beginning when we first started doing this in December. The only thing that was a little different this time is the ACIP committee had always been meeting the day after the FDA. So I think a lot of people didn't realize that those two things were happening. So I would just ask everyone to be patient and to trust the process. It's worked well for us up to this point, and we'll have more information later this week, and then we'll be ready to roll it out to everyone who's eligible.
Great, more to come on that. And Ajay, we'll leave the final thoughts to you to wrap us up.
Well, I want to thank everybody to get online quickly and to talk about this really important matter here right now. This week is going to be exciting, at least for us. We're looking very much forward to ACPI's recommendation right now. And as if new information emerges, we will be ready to make sure that our websites are updated, our communication channel is updated, and we are informing and connecting with all of you. And I just want to thank everybody for all the good work you do, making sure our community is aware of what's going on in terms of COVID pandemic and vaccination, and hopefully we'll be on the other side soon enough. Thank you.
All right, thank you. Thank you, everybody, for joining us today. More to come. Feel free to reach out to us in the meantime. We will always be happy to connect you with one of our amazing experts. So thanks for all of you for joining. Have a wonderful day.
Thanks.
Thank you.
Thank you.